Good afternoon, colleagues. On behalf of the World Health Organization, welcome to this webinar to explore the role of digital determinants of health and their implications for health systems and policy making, which is the 12th in our webinar series called Decoding Data and Digital Health. My name is David Novillo, and I am the Head for Data and Digital Health at the World Health Organization in the Regional Office for Europe, based in Copenhagen. In this 1 hour webinar, we will hear from a panel of experts who will raise awareness, identify challenges, and discuss the transformative role of digital determinants in health systems and their potential to bridge health disparities. Digital determinants of health are a core priority for WHO and for an integral part of the WHO Regional Digital Health Action Plan for the European region for the period 2023-2030. In collaboration with the London School of Economics and with contributions from global experts, we recently published the report addressing health determinants in a digital age. This report provides a valuable framework for understanding the transformative impact of digital determinants on health outcomes. And for those interested in exploring the publication further, of course, this is not a webinar for that, but we will put a link in the chat so you can look at this publication. So today, we have 3 renowned experts speakers to help us decode the digital determinants of health. We will have Dr. Ilona Kikbuch, Director of Digital Transformation for Health Lab, and a member of the Global Preparedness Monitoring Board, and also a co-chair of the World Health Summit Council. So we have Dr. Marlies Gorgens Prestige. This is the lead for digital and AI for human capital at the World Bank. And finally, we have Dr. Robin van Kessel, André Hoffman Fellow at the London School of Economics and World Economic Forum, and an assistant professor at Maastricht University. So Ilona, Marlies, Robin, I am a great admirer of your work in the field of digital health, and we are truly grateful for you having taken the time to join us today. So with this short introduction and without further delay, I would like to give the floor to my dear colleague Ryan Dos Santos, who will be moderating the discussions. Thank you so much to all of you for connecting today. Thank you.
Thank you, David, for that introduction. And I would like to echo the sentiments of David to our wonderful speakers, Ilona, Robin, and Marlies, for being a part of this. We're honored to have you here. Before I move forward with the questions, just for the audience, we'll basically be breaking this up roughly into some broad categories that we want to address, especially coming out of the research and the work we're doing in terms of digital determinants. One of them being the role of the digital determinants, another looking at the challenges to equitable digital access, and then, of course, importantly, the policy and governance and the solutions in terms of how do we address challenges. And of course, how can collaborative efforts help to support all of this work and to support ensuring that we are addressing the digital determinants of health. So in starting, I will start firstly, and this question is for you, Marlies. And I will ask some supporting questions of our other speakers. So how do digital determinants reshape health outcomes, and why are they pivotal in today's health landscape?
I think, Ryan, if we just all think about the time that we spent in the last hour, I almost want to say universally that all 330 people online and all of us as panelists would agree that we've looked at our smartphones not just once, but perhaps several times, even in the last hour. And really what that reminds us of is that we live in a digital world. And as we live in a digital world, we're increasingly the way we communicate, the way we receive services, the way we access information, the way we engage with the world, even the way we make friendships, the way we stay connected to family, it is all has a digital component. And so we know that in order to pursue health and well-being for all, that the digital determinants are just foundational to good health and well-being. And we know that we will not be able to achieve the Sustainable Development Goal of health for all if we do not consider fundamentally how important digitalization and the digital world in which we all live is for our health and well-being.
Thank you so much. And I think that's an excellent start to have us all understand that. So for Ilona, I would like to follow up on that. If you can discuss on broad policy implications of digital inclusion, and we'll get some more into that.
Yes, thank you. And again, thank you for inviting me to be part of this discussion. I mean, and as we all know, digital determinants are so important to our everyday life and to be able to participate in everyday life, in education, in work, in friendships, everything that Marlies has mentioned, then of course, one of the roles of policy is to make it possible for all people to have access to digital technology. And that, of course, means that they need access to, in quotes, the internet, the infrastructure, and all of the things that come with it. They need access, of course, to hardware. And we still, in our part of the world, underestimate how important that hardware is, and that not everybody can afford it. So, there's that whole complex of access. But of course, everyone also needs understanding. Inclusion means being able to participate, being able to understand what's happening, being able to use the technology. And therefore, all these elements of what is called digital literacy, digital health literacy, all of that becomes absolutely critical. And of course, also the other side of that use, and that is that what one visits, what one uses, what one accesses is reliable. So a large part of policy is actually ensuring quality of information, ensuring education and understanding, but also two things I'll just mention very shortly, which is particularly important for children and young people, and that is safety from harm. So how does policy, be able to regulate that particularly children and young people are not harmed, and then the protection of rights. And that leads us into the whole area of data use, data rights, data exploitation, extraction, and other things. So I think there's a very large policy arena from access to rights that we still need to explore. And as a last sentence, that I think health ministries and public health is not sufficiently involved.
Thank you so much, Ilona. And I think those are very, very powerful words and messaging that we definitely need to take home. As we all keep saying, digital is a part of everything, and we need to ensure that it's done in an equitable manner. So I'd just like to hand over to Robin in terms of the digital determinants reshaping. And if you can share some insights, some more insights coming out of the report on the transformative health impacts of these digital determinants.
Thank you very much, Ryan. I'm more than happy to. So in this report, over the course of about 15 to 16 months, we really tried to take a comprehensive look at how far the digital determinants of health stretch. And what we've come to find out is that, well, digital determinants of health is not the only realm of health determinants that's affected by these digitalization efforts. Social determinants of health have been well renowned since the late 80s, early 90s, and ever since the political and commercial determinants of health have increasingly received attention as being profound impactors of health. And now with these digital transformations, all of these other realms are equally being affected. So in terms of put that into concrete numbers, we found 127 determinants scattered across those 4 domains that either were newly emerged or changed as a result of digital transformations. And after some prioritization, we found 30 high priority determinants, 20 in the digital domain, 6 in the social domain, and 4 in the political domain that need to be addressed moving forward in order to make sure that these digital transformations are both a benefit to health and to protect digital transformation, or to protect populations from being harmed by these digital transformations.
Thank you so much, Robin. And I think there's some important information to highlight that we're not just looking at these digital determinants in a vacuum, but we're also importantly looking at them along with all the other determinants of health, such as our social determinants. Thank you so much. So I now move on to, we have all of these digital determinants and we're starting to understand them, but what are the challenges to equitable digital access? So for Robin, following on with you, what are the key barriers to achieving equitable access to digital health tools?
Thank you. Thank you for that question. So I would first echo a point that Ilona made. I think we start at data. Equity in digital health tools is so incredibly reliant on different forms of data on how people access health services, how people engage with the online world in general, data that is used to develop new medical technologies, data that is used to measure meaningful health outcomes in different population segments, data to model and track disease trends or well-being trends at a population level. Then there is a policy aspect to all of this. We need to make sure that our regulatory affairs or market access policies are fit for purpose to be able to measure some of these digital health technologies that are emerging. Notable examples here are the DIGA framework in Germany or the newly established AI community at the FDA in the United States. We need to make sure that our health technology assessment is able to capture the full range of benefits that these digital technologies can bring, not just the clinical benefits. And then finally, we need to make sure that the end users are actually willing to use it. And I'm happy that Ilona already introduced this topic. We need to make sure that people have access to the digital world, that people have the sufficient skills to navigate the digital world, but then equally as importantly, that people perceive the value that these tools can bring, which is equally as important as measuring the exact value that can bring. It's both a belief and a measurement instrument that is necessary here.
Thank you so much, Robin. And I want to build on that now, and I would ask Marlies. And Marlies, in following up to that, in addition to what Robin just mentioned, what are the challenges to equitable digital access where the health sector needs to work with other sectors? So in other words, those areas outside of the traditional health sector, because we also need to consider those.
Yeah, thanks, Ryan. I want to come back to my analogy of the smartphone that I used earlier today when I answered your first question. I want us to imagine for a minute that every human being on Earth has access to 1 gig of data and a smartphone and knows how to use it. I think we will fundamentally see a different world if these fundamental and foundational issues are available so that people can interact with their health in an entirely different way. And in order to do so, if we think about that analogy and the possibility of that in the future, then there are 3 areas, 3 foundational challenges we really need to focus on. The first is energy poverty. If we think about the fact that there are still almost 1.2 billion people in the world who do not have access to reliable and affordable electricity. Without electricity, we can't charge smartphones, we can't learn at night. There are many things we are unable to do. So energy poverty is the first and really important foundational challenge that is preventing us from achieving this equity that you've described and from realizing and unlocking the potential of how digital transformation can really support health in a very foundational way. The second is what I would call data poverty. We know that to access 2 gigabytes of data in low-income countries is around 11% of monthly GDP per capita. That is more than the entire monthly transport costs to go to and from work every single day in a low-income country, which is around 9% of monthly GDP per capita. As long as data are as expensive as that in places where digital can bring the most benefit, this is a second foundational challenge, and one that through better connectivity and meaningful connectivity, we absolutely need to address. I think about all the primary healthcare facilities in the world and how many of those facilities, the digital connectivity of that facility is really dependent on the nurse at the facility having her smartphone with her that is charged, where she can WhatsApp or communicate with patients, with other providers, and so on. this foundational connectivity of patients, providers, but also of health facilities themselves is a foundational challenge to achieving and unlocking this potential that digital determinants can result in better health. We know that the UN Global Digital Compact of last year, one of the priorities is to connect all schools and health facilities to the internet. And then the third and last challenge Ilona touched on, and I would say that it is about learning or digital skills poverty. But here I want to go a step further and say that I think it's also about how not being able and not having access to a phone, not having access to the digital technologies that many of us take for granted, robs one of the opportunity to see what is the potential of how digital can make a difference or how it can impede access to services. Think about how an ambulance that needs to be used to transport blood samples and results of laboratory tests to and from primary healthcare facilities, if that is replaced by a digital system that can instantly get the result to a patient and say, you need to go to a health facility. The lack of access to that, how that impedes people's ability to receive good healthcare, to feel that they are healthy, and for providers to provide the good healthcare that they want to. And the last point that I would make is that I think those of us in the health sector, and I want to guess that most of us here today are in the health sector, we think about health as the outcome of all of what we do. And I would posit that when we think about digital determinants, they go beyond health itself, because health and skills and knowledge combined give people the ability to live a productive life. So it is about health, but it's also about people's human capital, their ability to interact productively with the world around them and to live a well-lived and prosperous life. So whereas we think about digital determinants and their role in health and how absolutely foundational it is to the way we live our lives these days, there's also the wider dimension of how productivity gains can help individuals thrive and can help economies grow, which helps everyone. And I think those are those three challenges: energy poverty, data poverty, and digital skills poverty are absolute priorities that we have to focus on to give everyone the opportunity for digital determinants to be determinants of health and not determinants of unhealth, of being unhealthy, which I think the lack of access often can be these days. Thank you.
Thank you so much, Marlies, for that wonderful answer. And just to underscore the answer coming out from Marlies and Robin, that it's important, and we're all, or most of us probably are within the health sector, but it's also so important to think about the other aspects outside of the health sector, which impact everything that we do. Those underlying supported factors, I would say, such as energy, such as access, to the internet, cheap access to the internet and so on. If we don't have any of those, we can't even start to address the digital determinants. So I just want to deep dive a little bit more, and this one is for Ilona. In terms of some of what came out from the answers from Robin and Marlies, some of the things mentioned were in terms of the socioeconomic disparities and another areas such as the digital literacy gap. How do these barriers manifest in different demographic groups, and how can we address those disparities?
Thank you for that. And of course, there is differences between people, between ages, between cultures, between genders, etc. And particularly thinking of some of the things that Marlies said, we know how important the access to the internet can be for women in terms of their health. But if the family only has one phone, and if that is controlled by the man, can, then that can be very, very difficult. And so we have cultural and power divides within the digital determinants that are very, very important to look at. The other is, of course, in relation to age. And much of what we have said is, in a way, in relation to people who are, well, to a certain extent grown up, let me put it that way, who can take decisions. And we are still in a situation that many of the laws are also made for adults and don't look at the specificities for children and young people, that there might be particular protection needed for people under a certain age in terms of access to programs and activities that are totally okay if you're 16 and over, for example. At the same time, one of the really critical things, and it's similar for young people than in some cases for women, and as you know, in our DTH lab, we have had conversations with young people all over the world. There are, of course, particularly two issues where young people are looking for advice but cannot go to their parents, are far removed from health professionals, and that is in relation to sexual and reproductive health, where they need information, where they need advice, but reliable information and advice. And the same is true for mental health. And we heard from young people all over the world, some of them quite young, saying, you know, I need access to these kind of programs, but which are trusted programs? How can I do that? How is that related to age barriers? And all of that, all this necessary and to some extent also very helpful and a positive approach where technology gives access which you otherwise would not have. You know that in the most developed countries, take the country I live in, Switzerland, it takes up to 6 months and more until a young person can have an appointment with a mental health professional. So, you know, offering something, not just geographically remoteness, but, you know, really service access remoteness has to be addressed. That's wonderful. But at the same time, we have not introduced the safety barriers that are necessary, that the very same tools that bring so much for health and societal development at the same time can be incredibly dangerous and cause immense harm to children and young people. And I think in terms of policies, we need to be able to balance that in a much better way and recognize that even good regulation, if it doesn't take special situations, particularly of children and of women and other disadvantaged groups, think of some indigenous populations, other things, into account, will not be good regulation.
Thank you so much, Ilona. And this segues nicely into the discussion that you just started, into looking at it from a policy and governance perspective, and how can we find solutions to bridge the gaps and to address all that we just started to discuss. So pointedly and specifically, what steps can governments and other stakeholders take to create a more equitable digital health ecosystem?
Me?
Yes.
Okay.
So it follows nicely from what you started to discuss just now.
Well, as I think we've already discussed, the very, very first policy priority is to ensure access along the various dimensions that we've heard. And some of that access can only be ensured if the government invests in electricity. It can mean, you know, Wi-Fi availability. We have to look at certain things as public goods that we have not looked at as public goods. And particularly Marlise's point, if the access to digital means so much for productivity, for economic development, for social capital, and so many dimensions, there is really the question, why is Wi-Fi not just a public good? Why do people still have to sign up to programs and other things? So, we also need a different way in which we think about this access to the technology, to all the wealth that is out there. And it becomes even more important in terms of AI. We have this discussion now that suddenly there's an AI system out there that's for free. And therefore, I think that poses quite new types of questions. What do we consider part of our social contract? If the digital is so important for our societies, for the rights and development of each and every person in a society, then the access to this has to be part of the social contract. It cannot just be left to the private sector. And I think here we will see one of the major clashes between different societies where the outcome of regulations, whether regulations want to go down that road of public access, of security and safety, or whether they say, well, all of this we leave it to the private sector. We have an extraordinarily expansive understanding of free speech, and whatever happens in society and whoever experiences harm, well, bad luck.
Thank you so much, Ilona. I think it's very important aspects highlighted here. And I think underlying all of it is that all of this should be part of this social contract that governments ensure to make that enable it reaching our populations. You highlighted and you touched on an important aspect, which is artificial intelligence. And it's something that has entered the discussion all over. And we know for a fact that our populations have started to actually turn to artificial intelligence for asking it about their health. So we need to ensure that this is done in a very structured manner and that we protect our populations. So for Marlise, I have a question for you in relation to this. Can you highlight the importance of robust data governance and ethical AI use, and how do we ensure that we protect our populations in the development and use of artificial intelligence technologies? I think you're muted, Marlise.
Absolutely. Thanks, Ryan. I want to turn back. I agree with you. I think this conversation on AI and all the rapid developments on this new wave of generative AI has really focused the attention on the importance of data. As you've said, data is, and as Ilona mentioned as well, data is absolutely foundational to anything good in our AI, whether it is retraining a model for local use, whether it's post-market surveillance, whatever the case might be. And so I'd like to suggest that there are 5 key things we need to think about when we think about good data governance. The first is just to recognize that there is a new social contract for data, a new social contract in terms of between those who produce the data, those who own the data, and those who use the data for different purposes. And in this new social contract for data, the voice of low and middle income countries and the voice of vulnerable populations and populations with less access is obviously incredibly important, because AI can, at a very rapid speed, accelerate the digital divide that already puts people in a place where they may not have the access or be able to tap into the benefits that are available. The second one is to turn our attention in health, not just to bringing data together. I know interoperability and hyperfragmentation is something in data in the health data space that we think about a lot these days. But beyond bringing all the data together is really thinking about the value that the data can bring. And when we can think about data in terms of not just bringing it together, but the value that it brings, it adds a new impetus, and it helps us to bring more political will to the importance of how the data can be used for good and protected from it being used for harm or misuse, which is obviously incredibly important as well. Then the last area is to ensure that we do the kind of equity analysis that when we think about access to the benefits of data, that we understand the equity dimensions. Because again, without equity, we are going to be in a place where some people benefit immensely and exceedingly so in exponentially accelerated ways, whereas other people, again, in immensely accelerated ways, do not have the benefits. And the harm that could come from that is immense. I also want to say that I think when we think about AI, it is such a hot topic at the moment. And I think the real challenge and the opportunity and the potential is there, but the real challenge for us is how do we find that middle ground between not being overly careful, but also not being under careful, if I can put it that way. And by being rigorous in understanding where there is lack of access, in understanding where there is lack of representation, in doing machine unlearning if need be to ensure that the biases that are built into the data are removed, and to ensure that low-income countries can, and vulnerable people who do not have access, that their voices are heard as well. We need to make sure that our data governance frameworks are strong in every country, and we need to make sure that they think and take these considerations into account, so that we do not create a society where people with AI can live one kind of life and people who do not have access or who've not been represented in AI is completely unable to be part of this life and the way that societies are developing. So I think it's an immense responsibility that is there for all of us in the work we do individually and the work we do in our institutions to think about these questions in a really foundational way. Think, for example, if you're a physician, I had an interesting conversation yesterday with someone who said, I wonder if it would be a violation of one's Hippocratic oath one day not to use AI. I'm not saying that it is, but I think it's these kinds of ethics questions that when we design our data governance frameworks, we really need to think about. And let me just say one last thing in this regard. There's a lot of discussion about the governance of AI, but we also need to think about the governance for AI. And what I mean by that distinction is that the governance for AI means that we need to think about health governance and regulatory frameworks that may be in place that are not focused on AI, but that might need to be changed in the face of AI, right? If we have one day robotic surgery is done, for example, where does the liability lie? If an AI makes a recommendation and a physician accepts that recommendation and it's a wrong recommendation, where does the responsibility for that decision lie? These are things we need to very carefully think about, and we need to think about our health system and its regulations writ large and not just the AI components of it, because AI can affect all the other parts of health that we also think about. Back to you, Ryan.
Thank you so much,
Can I just come
Marlies.
in for a very short or two very short comments. One is just taking further what Marlies has just said. We've also in health and otherwise have to think of governance with and governance by AI. And that is also something that's going to challenge us in a whole number of ways and is already being done in some ways. So that's one side of things. Also in relation to the really important things Marlies just said about the whole data complex, at the DTH lab, we're working with a concept that we call data solidarity, which links, to the notion of social contract and starts out not from data privacy, but starts out from data use. So the issue is this data of public value? And that we treat data which has public value differently from data that is used for private profit. And we've been working with Barbara Prainsack in Vienna and her team to look at, how one can have a way to actually define the public value of data. But I think that's a road we will have to go, that we can't just look at the privacy side of data. We've got to be able to look at the common good and the public value of certain types of data. And we've got to look again at the harmful consequences and harm mitigation and rules that actually then give compensation to people who have been harmed by data use that is not appropriate and harmful. Thank you for letting me jump in.
Thank you, Ilona. So we have quite a few questions from our audience, and I know we're actually on quite good time, but I would really like to allow some of the questions for the audience. But before I move on, Robin, do you have anything else to add to what was said by Marlies and Ilona in terms of policy and governance solutions for bridging those gaps? Over to you.
Yeah, thank you very much, Ryan. And I would like to emphasize that perhaps in my response, I might be slightly polemical, but I don't disagree with anything that has been said so far. I think we are in many ways at a crossroads, whether it comes to data, whether it comes to AI. In order for us to determine how these new technologies, how these new phenomena fit in our health systems, we need to consider, do we want to go down a technology-focused paradigm, technological imperative, or do we want to go down the value-based paradigm? And Marlies, in terms of where do we find the middle ground, I personally don't think that is by focusing on the most advanced or the most complex of technologies, but the ones that creates the most value, even if that is a 2-, 3-year-old, 4-year-old, 5-year-old technology at this point. In terms of data is a very interesting bit, and I'm glad it was already slightly touched upon, but data is not per definition valuable. There's a lot of data out there, but most of that data is poor quality. So we need some semblance of being able to distinguish what is a data set containing low quality versus what is a data set containing high quality. Now, luckily, there's an ongoing EU project called Quantum that is developing such labels for data sets in the context of the European health data space, which is the European initiative to facilitate a secondary use of data with a lot of other things attached to it. One of the central points being the facilitation of the secondary use of data. Now, in terms of concrete policy frameworks in the context of AI, I mean, we can point to the EU AI Act that has been in force since mid last year. We can look at the South Korean law on AI that was recently adopted. We can look at the US FDA guidance for AI medical devices. These policy frameworks are emerging. Whether they're successful, time will tell. We don't know. My best guess is that these policy frameworks will need some tweaking and adaptation for them to truly hit the mark that they're supposed to do. But that's okay. I mean, it's a matter of trial and error on all fronts. But most importantly, I think it all comes back down to we need to generate value within our health system. Currently, we spend about $3 trillion per year on low value care. Improving our data flows, improving our data or our health delivery services, improving the quality of healthcare through, with or without the use of AI, is going to be tantamount to reducing that immense number of low-value care being delivered and addressing, to some extent, also the health financing crises that we're facing by getting more value out of the money that we invest in health.
Okay. Thank you, Robin. So I will move on now. And what I wanted to move on and touch on was collaborative efforts, because and especially was highlighted in the report, part of this is ensuring that we address collaborative efforts and partnerships. So I want to quickly touch on this, and then I'll move on to the audience's questions. So quickly from all of you, how can partnerships among governments, tech companies, and communities drive equitable digital health solutions? And in relation to that also, one of the things that I think a panelist asked, pretty much exactly that, in terms of, they want to know how, from a global perspective and a global partnership and collaborative perspective, we can look at all of this. Over to you. And feel free, any one of you, to take, and this is an open discussion coming from you in terms of collaborations.
Well, I think there's a problem. I think obviously, whenever there's a big change in society that involves very different parties, there has to be some coming together at some point in time. But it's usually around a framework. Marlies earlier also mentioned an ethical framework, etc. I was very intrigued. I was watching one of the Davos discussions, and they said, with this rapid development of digital and AI, one is reminded of the discussions in the 50s and 60s around nuclear energy. And at that point, the world came together and produced a nuclear proliferation treaty. So they produced a framework within which this new technology was developed. We have no such frameworks. We have the compact that was mentioned by Marlies, but we have no framework, and we seem to be in a geopolitical situation where it will also be incredibly difficult to develop such a framework. And we have seen, for example, and of course there is collaboration of WHO with the tech companies. There has been collaboration, particularly during COVID-19, to be able to identify bad information and all these things. But if you look, at the recent developments where American tech giants overnight changed their orientation to suit a new government, it is incredibly tricky if you are dependent on, major economic actors without a framework. And we have, and the Davos discussion showed this. Brad Smith is one of the people who is also spearheading this thinking of Microsoft, sort of saying, we need a global framework for this development within which countries develop their policies, which also sets the parameters for public-private cooperation and in this incredibly important space, particularly because this space is developing so rapidly. I mean, just think how everyone was, gazing at these 500 billion that were put on the table to develop the data centers, etc., in the US. And then overnight comes a small thing out of China, and the stock market crashes nearly. So you can see without a framework, and I think, this idea about the nuclear proliferation treaty is a very interesting one. Without such a framework, it will be very, very uneven as we move forward in terms of looking for partnerships. Thank you.
I want to add, Ryan, to what Ilona just said. Ilona, I think your idea about such a global framework is a really interesting one. knowing how hard it is to get there, I would say that if I was a Minister of Health listening to this conversation, what I would like to take away from this is that even in my country and even in the absence of such a global framework, there are important conversations that ministries of health are in unique positions to spearhead, and I think have a responsibility to spearhead. One of them, and I think one of the most important ones, is how do we know when we've been successful with AI, right? How do we know what are the metrics we use? What are the evaluations we're going to use? How are we going to think, as Robin said, about health technology assessments that take the full range of impacts into account? If we are going to do an impact inventory and understand really what the positive and negative impacts are, how do we do that in a good way? How do I compare different AI interventions? And we need to design these value metrics and evaluation methods, not just keeping today's AI technology in mind, because everyone it's generative AI, but generative AI is not where AI is going to end. And if I was a Minister of Health, one of my first priorities would be to say, when do we know we've been successful? And partnerships is almost such a cliche. We know we can do nothing in health if we don't do it in partnership. But I think the special urgency to have partnerships in AI, partnerships of mutual benefit, where those who provide the data, those who use the data, those who evaluate, come together in a way where everyone has their own benefit to their participation in the partnership is absolutely essential. And yeah, and I think these are some of the things that countries can move towards and work on, even as some of the bigger, more global discussions take place.
I don't disagree with you, Marlies. And of course, these things have to happen, particularly if something is developing so rapidly in parallel. But still, just think you're a poor African country and you want to go down this road as a health minister. Who do you turn to and what do you get? Do you turn to China that's offering something to you, or do you turn to the American tech company that's offering something to you? And how can you guarantee in this new geopolitical world that you are not only interesting to either of them in terms of the data extraction that comes with it, because health data are some of the most valuable data in the world. So even while one is doing that, hardcore work on the ground, and I couldn't agree with you more, we can't say, well, let's wait for a global treaty, my God, but we definitely also need to show in these everyday necessities and applications, why it is we need a joint framework so that that minister can rest assured the same values and the same principles and the same ethics will apply to whichever partner I will choose, and that not all the weight lies on me to have to do that homework on top of everything else.
Yeah. No, I very much agree, Lena.
Can I interject? And sorry for interjecting, colleagues, but I know this is a discussion we can take on quite a bit, and I really appreciate your comments. But I would love to give Robin a little space to talk, and then I would really love to have some questions from our audience, also our very important audience. Thank you.
No discrimination here.
I think working towards a global treaty, a proliferation treaty of some degree, indeed could offer a very robust and valuable framework. I just cannot ignore the prioritization of health within the political context. And I think, Ilona, you wrote about this extensively, is that except for a slight exception during the COVID pandemic, health has never been a profound political priority. So, I mean, as unfortunate as that is, it is also the reality of the situation. So as a health minister, perhaps the first step should not be to rally the troops, but to start branching out into into other ministries, whether that be finance, whether that be homeland security, whether that be internal affairs, and take stock on what the risks and benefits of AI are. In those cases, to make a combined, almost a conjoined statement across multiple ministries, knowing that for better or worse, this will be more likely to be taken seriously than a health impact reasoning that seems to have dropped in prioritization in recent months again, unfortunately.
Thank you so much, Robin. And in bringing this conversation back down to earth, I'll field some questions from the audience. So one, I think, is a very important and pertinent question from Hussein. With so much of our lives now spent in front of screens, working, socializing, even managing our health, and we're pushing digital determinants, how do you see digital technology shaping lifestyle habits in ways that may contribute to, for example, non-communicable diseases? Are we unintentionally designing a world that promotes sedentary behavior and unhealthy choices? Who wants to take this?
The data show that, and maybe Robin has a number of them at hand, but we see that, I mean, we work mainly with children and young people, and we see that for a number of kids, being constantly glued to their screen, we see issues of eyesight problems, we see obesity problems, we see sleeplessness problems, we see the extreme case for a small group of young people, addiction problems. So, there's quite a range of health problems and issues that emerge from a, digital lifestyle, while at the same time, you can track your steps or whatever. But it really, we are in this intermediate situation where as a society and as individuals, we have not yet fully found the balance. And, sometimes we are forced to be glued to our screens. So just think of all the Zoom meetings I had today. There are very, very concrete and very negative health impacts, and we're starting to get more and more of them.
Robin, you want to interject quickly?
I mean, in terms of are we promoting it, we need to look as far as the social media that we consume every day designed to keep our attention. Is that promoting unhealthy choices? Well, depending on the content that you consume, sure. But the fact that the underlying system already promotes or already is designed to keep your intention on that platform for as long as possible, instead of setting a cap at 15, 30, 60 minutes, however much, that cap needs to be artificially imposed by you, the user, and is oftentimes difficult to either find in your settings or woefully absent. But in terms of, are we promoting an unhealthy society? If we look at problematic internet use alone, that has been linked to anxiety, depression, mood disorders, body dysmorphia, eating disorders, social disorders, addiction was mentioned, and a myriad of cardiometabolic conditions. So in long answer, yes, very much so. The short answer is yes.
Thank you. So I have another question, and I will field this one to Marlies, and after the others, feel free to interject. It was mentioned in terms of the whole entire, what we need to think about in terms of the digital determinants, but we also need to look outside the health sector. It was mentioned energy poverty and data poverty. A question is asked here, what about design poverty? Digital skills might be enough and having everything else, but unassailable or inaccessible design might also be a barrier to overcome. What are your thoughts?
Ryan, I agree with you. I agree with what the person asked and answered their own question. Absolutely. And I'll tell you where I really saw this come to life. There's a fantastic study that an organization called Resolve to Save Lives did. And their choice was to work with countries not on bringing health data together, but on the real minutiae of what does the user input screen look like? How many times do you have to click to go from point A to point B? For example, recording somebody's blood pressure in an electronic health record. they were able, for a single interaction, to reduce that from 13 seconds, I believe, to 3 or 4 seconds. The amazing thing about that is that's just for one patient. But if a nurse is doing that for 200 patients in a given day, that is a lot. Those seconds per individual patients add up to a lot of minutes for a nurse. And this is just one example of where how we think about design changes what we put together and how we do it. And similarly with even making choices about which aspects of the health system to digitize. I remember being at a health facility and being quite excited discussing with the health staff there about a new digital intervention. And, one of the people looked at me and said, "It's such a great idea, but can you please fix the ambulance first?" Right? And so I think that was just, again, a reminder to me that the solutions that we choose need to be the ones that solve real problems in people's lives. And human-centered design is obviously absolutely critical to that. So just to say, I very much agree with, in the affirmative, with what the person who asked the question said.
Thanks, Marilise. And I think part of this also comes back to having, and it goes back to collaboration, but on a more grounded level in a way, that we need to be inclusive when we are dealing with digitalization, when we're trying to include digitalization in the systems that we're doing. Ensure not just our patients are covered, but ensure that our healthcare workers who are going to be using digital systems and the population are all part of the design and implementation. I have a question for Robin.
I can just add here a similar example, and that is, we're doing a lot of discussion around, children and smartphones and being glued to smartphones, et cetera, et cetera. And so there's been, now a big focus on that, and that children don't move enough. But we've forgotten to discuss, is there a playground? And how safe is that playground? So for me, that is the analogy with the ambulance that Marilise just mentioned. So as we get focused, rightly so, on, the determinants of the digital, let's not forget how, our health promoting environment can be quite deteriorated, and that it needs as much investment in real life, and in this case playgrounds, as it needs in safe online tools. So we tend to sort of now, because it's new, move in the one direction and forget the health in all policies in terms of social determinants in the other side.
Thank you, Ilona. So I think we have enough time for one more question. Unfortunately, I know this is a discussion that I think has been very, very fruitful. But for Robin, I have a question. When you mentioned what you select around the 25 digital determinants as key, do you think that they can vary between regions and countries? And can you shed a little bit more insight into your selection of those determinants?
Absolutely. And do they vary between regions? Absolutely. We took great efforts to make sure that digital determinants that are prevalent in all 6 major global regions were represented in our study design. That led to the identification of this 127 total determinants that were changed as a result of the digital world. Now, in terms of prioritization, if I look at the determinants that were actually prioritized thanks to a panel of 30 experts that kindly helped prioritize these. We look at internet access and connectivity as being one of the determinants, but equally we look at the data culture, the regulatory mandate, data governance and ethics structure that is implemented in a country. These determinants can vary already substantially within Europe and between other regions as well. Not every country is as digitally connected as the other. And it was mentioned already earlier as well that, for instance, approaches to governing misinformation and harmful content, they can change overnight for one region but stay the same in another. These determinants this report and these determinants are supposed to be a starting point. And from this point onward, it's up to more local actors to hopefully look at this report, be inspired to look at what the state of these determinants are in their context, and take that forward for the betterment of health.
Thank you so much, Robin. And unfortunately, we are out of time. I would just like to give some closing comments, and I would just like to thank our wonderful speakers for all the very detailed and in-depth information that you've given for us. And for us all this is just jump-starting the conversation to keep at the front of our minds that these digital determinants are very important. And as Robin mentioned, they're cross-cutting all the different areas regionally in terms of our lifestyles and everything else. But also importantly, in consideration of digital determinants, we cannot lose sight of everything else, of all our other determinants, of social determinants. It's also important that we collaborate across sectors and, as Robin also mentioned, across ministries and so on, etc. And also we need to, and as mentioned by Marlies and Ilona, we need to also ensure that we look at the other mitigating or co-funding factors, such as ensuring we have proper energy, ensuring we have proper data, and cheap, reliable access to data, ensuring that, as was highlighted by one of our audience members and collaborated here, design is also important, and ensuring that all of this fits together within a very strong ecosystem moving forward. Because whether we like it or not, digital is part and parcel of our healthcare now, and it's only going to become stronger and stronger moving forward. So I would just like to thank you all so much for this, and I would like to thank our audience for being a part of this. 340 odd members of our audience. Thank you all so much. And thank you for this very fruitful discussion. And hopefully we can take some of this forward as we go along. And of course, thanks to David, the head of our unit here, and to my wonderful team supporting me on this. I'm hoping to see you at our next webinar on the 26th of March. And that one we'll be looking at governance, data governance. So thank you all again. Have a nice rest of the day.